Lens mass, range soft. I will not accept any apologies, Randolph. Just to take note, that's something I will not tolerate. That's noted. Noted on that?
Yes, Doc.
Okay.
I I I checked the
Okay.
recording for our last
Yeah.
class, and the last slide is yung lens, the future.
The feature over here, 60. Is it really 64 or
It's
sixty?
the last slide. Yeah, this is the last slide that you present.
Okay, gotcha, gotcha. So we're going here. All right. So we're moving now to from soft design to soft fitting. So we're moving on to a different slide now. Let's go fitting sphere. Okay, so we're going now for this slide. Randolph, are we good? I'm not gonna include the future side. Although the future side is more on like what are the technologies to be included, what are the things that we can do, and all of that. Okay, so let's start fitting spherical soft contact lens. So soft lenses, we have AKA alternative names from past to present. We have hydrophilic, hydrogel, gel, flexible, limble, semi-scleral, limble, and paralimble, and pliable. So if you try to understand based on the title or the names, hydrophilic because it's water loving, because it's hydrogel because of its water content, hydrogel because it is a hydrogel, gel because of the gel component, flexible because of its flexibility, limbal and semi-scleral, or limbal and paralimbal because of its diameter, which is around 13, 14, 15. And pliable, again, because of its softness. So clear so far on our end? Okay, confirmed? All right. Now, as for design soft lens size, we have range of total diameter of 13 to 15. This is a rough range available, which is most common total diameter is 13.5 to 14.5. Okay. Next, soft lens fitting philosophy. As you can see, this is how soft contact lens is worn. It conforms to the shape of the cornea, from the corneal apex all the way to the periphery, which is your limbal up to scleral, or the perilimbal region. Next, when to fit spherical soft lenses, the lens of choice, of course, is soft because of its comfort, because of its, com- again, the properties, of course, having the most comfortable, if experiential is what we're looking at. And then we have spherical refractive errors, which is, as we're looking at here, should you have a cylinder, soft sphere can only tolerate the negligible astigmatism. When you say negligible astigmatism, it means like forgivable astigmatism up to 75. That's why masking can be done in most cases because this is a negligible astigmatism. But you go beyond 75, like one, it's already essential to give cylinder. But try to understand this is also a case to case basis based on the sensitivity of a patient. Some patients are most likely dependent on how sensitive they are. Even a 25 can be something significant for others, while others can tolerate as much as 75. When comfort is a prime issue, we want, of course, the soft for its most comfortable feel. Now, extreme refractive errors, including aphakia. So, in of course, if you lose your crystalline lens, you will be needing a high plus correction. And if you think of using spectacles, that would be very thick. Now, the advantage of a contact lens, because it's in contact, it doesn't need to be very thick and very visible. It's not going to be that visible for others because, again, it's in contact. Next is plus the lens power, of course, because the plus lens loses its power. Um, Plus, of course, extreme refractive error, including, uh, as I've mentioned, aphakia, low RX RGP comfort not balanced by two, small increase in vision, wherein, of course, as you will be experiencing next sem, RGP is it's even though it's a case to case basis, but still not as comfortable as soft contact lens. Significant corneal astigmatism, but with a spherical manifest. Okay. Next, we have soft lenses must center on the eye because of the optical center that carries the power, right? Next, it conforms to the anterior part of the eye, which is your cornea. It needs to move adequately. We want it to be moving. Why? For the flushing of debris, tear exchange. We need contact lens to be moving. Not extremely loose that it's moving a lot, but adequate. Covers the cornea in all eye position. Such as, if you would notice, a soft contact lens has a diameter of 13 all the way to 15, then it must cover the cornea in all eye positions. Now, soft lens performance requirements, we have produced good and stable vision. Of course, what's the point of rectifying errors of refraction if it doesn't help you in having good and stable vision? So it should produce good and stable vision. It also provides minimal physiologic disturbance and wearable for practical periods. And of course, be comfortable. Okay? Now, this is how we will do in the lab, Randolph. We will be assessing our contact lens fitting already by this Saturday. So by the use of this Cartesian method, we can assess whether the fit is good or not. So you can see there the coordinates y and x coordinates. The y is your vertical and your x as your horizontal. The plus sign is given to superior for the y coordinates, while negative is given to inferior. Now, plus is given to x coordinate when it is nasal, and negative when it is temporal. Are we clear so far? Any questions?
Wala naman po, Doc.
Gotcha. Thanks. Hey, Zach. Gotcha. Next, you can also see that when you are doing centration, you will be giving me, this is part of the quiz, of course, giving me values. So if it's well centered, then y should be 0, x should be 0. But if it's decentered inferiorly, but there is no deviation nasally and temporally, then what you will have there is x 0, y, if I would estimate here, could be around 2 to 3 millimeters off. Is it positive or negative? Of course, it's negative because it's inferiorly located. So your y value is roughly around negative 3 millimeters. Any questions on that?
No po, Doc.
All right. Now, next is, uh, as you can see, if it's decentered nasally, but not inferiorly nor superiorly, then y is 0, x is positive. So I'm looking at positive 3. And if it's decentered, like in our last example, it's inferiorly, it's superiorly decentered and temporally, in that case, then you have x as negative and y positive, and then the value. In our example, we use 3. So far, we're good. Any questions on this? We're good.
Yes po, Doc. We're good.
Okay. Lastly, is this binasal system. So the binasal system is just doing Cartesian only. The reference is both eyes, like instead of the Cartesian, which is a mono. So whatever you're doing in Cartesian, you're just doing it binasally. So almost the same. So this should be easy. So you can see how x as the, you have the coordinates again, the y coordinates and the x, which is exactly the same as the Cartesian, only describing binasally, meaning to say ODOS, or also known as OU. All right. So we end with this one. So as you can see, what you are to write, for example, you have to put there right eye decentered nasally, point 0.5. Over the other side, you have left eye decentered temporally, point 0.5, and up to 0.5 millimeter. Any questions on this?
None po, Doc.
All right. So I leave you with that. Let's continue next meeting. Again, my apologies for being late. Enjoy the rest of the night. Stay safe, guys.
Thank you, Doc. You stay safe
Th-
too.
Thank you, Doc.
Thank you,
thank you,
Doc.
Thank
Doc.
you po.
Thank you,
Thank you.
Doc.
Thank you,
Thank you,
Doc.
Thank you,
Doc.
Doc. Thank you po.
Thank you. Thank you.
Safe din po, Doc.
Thank you. Thank you. Thank you. Thank you.